The purpose of today's discussion was to talk about the Cross-Border Healthcare Directive, which includes a clause that says member states should cooperate and share information on HTA. So we're at the very early stage of what this will mean because of the differences between member states, but definitely there's a lot of scope for major changes over the next, let's say, decade or two, because these things move very slowly when they move.
This is a complex area. HTA, as I said, is in sort of an emerging science with lots of methodological question marks and areas for development. There's a great interest from all the stakeholders and from society at large as well. So having an opportunity to discuss that with stakeholders is always welcome and useful.
We have to pool knowledge in Europe. We should inhibit redundant work. And it's important for us to concentrate research work.
We're convinced that there are a number of areas where they have interest in sharing the expertise and in pulling together the expertise, in pulling the evidence, and in working together on the methodologies so that they are better able to address the challenges in making relevant and robust decisions on access to technologies.
In the network industries, you've seen quite a lot of development of networks of regulators, and that seems to be happening in the health technology sector as well, which is perhaps unsurprising. They're both independent regulatory agencies, and there are a whole lot of analogies about how they should be governed, and also issues about legitimacy and transparency and involvement of stakeholders.
The biggest challenge is policy, I think. Because we have different paradigms in different countries, and we have special contracts between industry and payers, providers. We have doctors. Doctors have one opinion in most of the cases, but policy is a problem.
We don't want to substitute and we don't want to interfere in the decision-making process at national level. That means that national bodies, national healthcare systems or regional healthcare system will make the final decision on uptake of technologies or disinvestment strategies.
There is clearly an added benefit when agencies start talking to each other, see how they are set up, what their national mandates are, about methodological approaches on how they do it, because that is different in each of the countries. But clearly, when you look at the pure scientific data that are coming from clinical trials on new medicines, those are basically the same for every country. So there would be an added value for countries talking to each other and see and exchange information on that.
The Commission says, Member States, we heard your message that you want to cooperate together on a number of specific issues on HTA. We cannot support this cooperation through projects. We need to have a permanent structure to work on these issues in a rigorous way and in a permanent way. This is the objective, one of the objectives of the directive on cross-border care, which foresees the setting up of a permanent HTA cooperation.